Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is medical fraud, waste, and abuse, oftentimes abbreviated FWA. So, believe it or not, fraud, waste, and abuse accounts for 3 to 10% of all healthcare spending, according to the FBI, who investigates this stuff. Now, CMS actually puts fraud, waste, and abuse into 4 categories. And we're going to go through each of those categories, and I'm going to give you specific examples of them. So, 1, just plain old mistakes. And oh, by the way, this is for employer-sponsored health plans in addition to Medicare. So because much of the audience that watches these videos is associated with employer-sponsored health plans, that's really what we're going to talk about here. So, mistakes. I know of an employer that had a $250,000 claim for a infusion medication that was billed to their medical plan. That same $250,000 drug was also billed to their pharmacy benefits as a pharmacy claim. Their carrier and PBM combined into one organization, they paid both of those claims. So they paid $500,000, $500,000. They paid twice. They should have only paid once. They should have only paid $250,000. I'll just chalk that up to a mistake. That, maybe it wasn't a mistake, but let's just say it was a mistake for this particular example. Okay, next up. Waste. Oh, by the way, carrier didn't pick up on that at all. They had a third-party data vendor that actually picked that up and reported that. So just know that the carriers, sometimes they'll just pay. Okay, next up, waste. Things that just don't need to be done at all. So I have good friends in New York City, husband and wife, who when they had their first child, the wife was receiving monthly ultrasounds from her OB/GYN. This was a normal pregnancy. It was at normal risk to her. She was a completely healthy woman. There is not a clinical indication for monthly ultrasounds. So the American College of Obstetrics and Gynecology does not recommend that. And yet her OB/GYN did that. Completely unnecessary. Okay, so total waste. Didn't need to be done. Okay, next up, abuse. An example of abuse is, this is where upcoding comes in. Where now, of course, one person's maybe the employer or the carrier's quote unquote upcoding the hospital and the physician practice, they would refer to that as clinical documentation integrity. So just know that there's really sort of, quote unquote upcoding to a certain extent is in the eye of the beholder. So, and I'm not here to debate that, but let me just give you one specific example. So, sepsis, which is a systemic response to an infection. Now, Medicare increased reimbursement for sepsis, and as a result, a lot of the commercial plans also increased reimbursement for sepsis because they oftentimes follow what Medicare does. And as a result, the number of cases of sepsis in America increased from 248,000 to 541,000. Was there some sort of epidemic of sepsis in America where it more than doubled? The answer is no. Conditions that used to be coded like pneumonia or urinary tract infection then got changed to sepsis because the pneumonia and the urinary tract infection coding did not pay as much as the sepsis coding. So the actual management of the patient didn't change at all. The actual cost to the hospital to actually take care of the patient didn't change at all. The only thing that changed was that they changed the coding so that they could get paid more. Okay, so again, is that clinical documentation integrity? Is that upcoding? That's another debate for another time. But that's how CMS categorizes it. Okay, next up, deceptive fraud. Things that essentially, it's stealing, it's lying, it's a scam. Okay, let me give you a few examples of that. So this was reported in ProPublica. You can look it up on the internet. So Southwest Airlines had their pilots and flight attendants were going to a personal trainer who was doing workout sessions with them, and then would bill the Southwest Airlines employee benefit plan as a physical therapy claim. This gentleman was not a physical therapist at all. He was a personal trainer, and it happened for years. He eventually got caught by his ex-wife And it turned out that it was over $4 million of claims that had actually been paid out by the Southwest Airlines plan. Now, another example, in the state of New Jersey, again, a story by ProPublica, you can look it up on the internet. I'll leave a link to it in the show notes. There were out-of-network physical therapists because the state of New Jersey, for like their teachers and their state employees, they had very rich benefits for out-of-network providers. And so these out-of-network physical therapists would go and promote their services and like bring donuts to like schools. Come get your physical therapy. They would go and get their physical therapy, and oh, by the way, they'd be like, oh, you also need a massage. And they would do medical massage, and they would charge $667 per medical massage. That's one heck of a medical massage that was paid for by this New Jersey the state of New Jersey employee health plan. Okay, so like just total fraud, like total scam. Okay, next up. So what's the current process in place to actually like catch this stuff, right? Well, it's supposed to be the carrier, right? So the insurance carriers have their own fraud, waste, and abuse departments. The problem is that the insurance carriers auto-adjudicate, meaning that they don't have a person look at it at all. It's only the computer that reviews the claim and then pays it for almost all claims under $10,000 to $15,000. So all these physical therapy claims and all these massage claims, like they weren't even close. They were just getting paid. And for a self-funded plan, the carrier doesn't take any risk. Okay, now the problem is that in the case of Southwest Airlines, the carriers refused an audit of their fraud, waste, and abuse practices. Okay, so oftentimes there's the old saying, trust but verify. But there currently is no verification process for the carrier's own fraud, waste, and abuse review. You just have to trust them. Well, in the case of Southwest Airlines in the state of New Jersey, that didn't work out too well. Okay, so one way, so people are like, okay, so I will bring this up, and immediately physicians in the medical community will say, yes, but then there's the prior authorizations by the insurance carriers, and they are denying claims and refusing to pay for care that they should pay for. Listen, you've got a good point. You can have fraud, waste, and abuse, and you could have egregious prior authorization requirements, and both can exist at the same time. Let me use this diagram to explain that. Okay, so let's say that the large rectangle is all submitted claims to an employee health plan. Okay, and then the claims with the dots, those are the ones that are actually paid. Okay, now the dashed lines over here, that's the fraud, waste, and abuse. In other words, it was a scam or it was because of incompetence, waste, mistakes, abuse, these four categories up here. Okay, so notice that all of this is dotted and striped. So this is fraud, waste, and abuse that has dots and stripes. So this is fraud, waste, and abuse. It's getting paid. Okay, then down here on the bottom, look, there's no dots. Why? Because that's the stuff that was denied for prior authorization, or it was just denials, right? And so here you have an overlap where the prior authorization actually catches the fraud, waste, and abuse. Note, that's only a very small rectangle. Now, so one might say, well, it all evens out in the end, right? So the amount of claims that were paid that were fraud, waste, and abuse essentially equals the amount that was denied in the prior authorization process. So it's kind of a wash. Well, that's not actually the case. And the reason that's not the case is because the claims that are being paid for fraud, waste, and abuse are for different providers than the folks that are getting denied for prior authorization. So you might have folks over here that are engaging in a scam and they're totally getting away with it. And then you can have other providers down here who are providing medically legitimate care that's getting denied for prior authorization purposes when it really shouldn't be. So both can be true at the same time. So just because both exist, that doesn't mean that we should ignore one or the other. In fact, both need to be addressed. So egregious prior authorization requirements absolutely need to be addressed, and fraud, waste, and abuse also 100% needs to be addressed. Now, fine. What are some solutions? Okay, this is not some sort of Eric Bricker idea. Okay, other employers out there have already addressed their fraud, waste, and abuse problem. What do they do? Okay, so the key is to actually audit the carrier. And I was speaking to a benefits consultant for large Fortune 500 employee benefit plans, and she said that one of her main strategy for cost containment for these very large plans is actually addressing fraud, waste, and abuse within the plan. She said that she's been able to lower the health plan cost by 6% for some employers by more strictly addressing fraud, waste, and abuse. There's like serious money on the line. And then I know of specifically of and how do you do that? You hire a separate fraud, waste, and abuse vendor to actually review what the carrier has to say. And if the carrier won't give you the data or won't let you review the fraud, waste, and abuse, then you put the carrier out to RFP so that you can have the ability to do that. And so I also know of an employer that absolutely did that. They actually went from one carrier, now they have 2 carriers. And they have an extra data analytics company that looks at their claims data, and they have a relationship with their account management such that they tell the account manager at the carrier to stop payment on certain claims, or if the claim's already been paid, to then withhold future payments to that provider equal to the amount of the claim that was already been paid. So this is not some sort of like it can't be done sort of thing. In fact, I know of an insurance captive that has kept healthcare costs flat for over 10 years, that doesn't have just one, but has 2 outside auditing data analytics, fraud, waste, and abuse vendors that review what the carrier is looking over. So it's a problem. It's a solvable problem. It's a potentially 3 to 10% of your overall claim spend problem. And I wanted to share with you medical fraud, waste, and abuse. Thank you for watching A Healthcare Z.